Well, I think we can probably go ahead and get started. Like I said, Jana is in a training today, and Joey had another appointment that took her out of the office this afternoon. So Caitlin Thomas from the Department of Health will be joining us hopefully in a few minutes. And so if with those questions, if there's something that Caitlin's not able to answer, or Tom or myself, then we will make a note of that and follow up and get the answer to all as soon as possible.
Okay.
So I think maybe I'll just let you kind of share the questions that you do have, and we'll take it from there.
Sure. And as I go along with these topics, questions, I'm sure others will join in and ask other questions as well. So just so we're all on the same page with that. One was dealing with the recent call regarding the vaccines. And I have a note here about verifying if CVS, or I think Walgreens was the other pharmacy, will make contact with CSPs when those vaccines are ready and figuring out how many doses they're going to need and things like that. Is that correct, everybody? I think we just wanted some verification on that.
Okay. Tom, is that something that you're able to answer, or is that something we should hold on to until Caitlin can join?
Yeah, I think we need to, I guess, maybe hear from Caitlin to see what she has to say. Yeah.
Okay.
Okay. What other softballs can you toss that we might be able to field in the meantime?
It wasn't
The next
much
one,
of a softball.
the other one, I don't know if it's necessarily a softball, but we do want to talk about rapid testing again. And I guess really the most important thing is that we really need to be a priority for this. It is a massive game changer, and it's really, really important that we get rapid testing. It sounds like there's some requirements that we're looking into, that in order to do these rapid tests, you have to have what's called a CLIA waiver. And so I guess we were just kind of wanted to follow up on the status of rapid testing, where it's at, if there's any availability out there, and making sure that we get on a priority list for this as soon as possible. This is perhaps more important than any kind of leftover CARES Act dollars that we have for covering costs. I mean, this is something that everybody is really in need of.
Dan, we were advances under the agencies that got some of the Department of Education tests. And like you said, it has been a game changer for us. And I know we're not the only CSP, but our cases of positive staff and people we support have just shot up, skyrocketed in the last week or so. And when we got those Department of Education tests, we were able to use them on staff who we would have probably had them work. The first day we got them, or the day afterwards, we had 3 staff come to work who had just slight, they had the sniffles, thought it was seasonal allergies. We tested, all 3 of them were positive for COVID. So we were able to immediately send them home. We've used, I think we've used almost 10 of the 40 that we've got. In some of the other cases, staff were symptomatic, but we tested them, found out within 15 minutes they were negative, and then we could just have them go to work with appropriate precautions that everybody is doing. So they have just been so valuable for our agency in just the week or so that we've had them. And I know area nursing homes have these tests. We just found out we have a staff member who's getting tested twice weekly in the nursing home she works at for her part-time job. She just came back as positive, so we'll take her off the schedule. But how can we get our hands, the Department of Education, we're not able to get our hands on any more tests from them. How do we get our hands on more tests?
Thanks, Brian. It looks like Caitlin just joined, and so did Lisa Cheddar, who is our one of our DDD nurses. So maybe I'll have Dan repeat the 2 questions that he just posed, and hopefully, Caitlin, those are things that you can field. And welcome to the meeting. We're jumping, pushing you right into the pool.
Sure. Hi, Caitlin. I think you're muted.
Man, it has just not been my day today. I only heard about the very last couple words of what the question was, so I will have to ask you to repeat. Thank you.
Okay, yeah, and your microphone is a little bit low. I'm not sure. I couldn't really quite hear you.
Okay. I was just saying, I only heard a little bit of what the question was.
Yeah, I still can't hear you very well.
You're still cutting out.
Really
Caitlin.
muffled.
Well,
There you go.
that's better.
That sounds good.
this is better? Okay.
Yes.
So I didn't quite catch the whole question because I signed in a little late from another meeting. If you could just repeat it for me, Brian.
Oops. I was just saying that we were able to secure some rapid testing kits from the Department of Education because we have some special education students, and they have just been so valuable for us, both in being able to immediately get staff off the schedule who are showing symptoms and testing positive, as well as staff who have had some symptoms and test negative so that we don't have to take them off the schedule. They have just been so valuable. Is there any way to get any more of those quick rapid tests for CSPs? I know nursing homes have them. Our local nursing homes here in Brookings have them. They're just automatically testing all their staff twice a week. Where did they get their tests? And can CSPs get them as well?
And Caitlin, I would just add that us CSPs, we're working with really highly vulnerable people to this virus, and getting us on a priority list if there's a supply issue or any of those kinds of things. I mean, it's really critical. It's a really important factor. So I'll let you respond.
Sure. Okay, so I agree with you, and I want to let you know too that Jana and Tom both have advocated on that behalf about your vulnerable populations and getting those. To answer the questions or the question about the nursing homes, they're required by CMS to do that testing that often, and they are getting those testing supplies directly allocated to them from the federal government, so they have access to a different kind of supply chain than we do. But I also, the reason why I was a little bit late joining you all is that I was on a testing work group call that I have with the director of the South Dakota Public Health Laboratory and others that are working on COVID response. We did specifically talk about an allocation plan of the supply that the Department of Health has of the Abbott Binax Now and getting them out to you all because community support providers and really all people who care for vulnerable individuals in congregate settings, I think is how we've titled it, are on that priority list to receive these tests. I did send an email out probably at the tail end of last week to our group, to Jana and to Tom that are working on your behalf, and it's something we can discuss in here. The thing that we need to understand about the Binax Now test is by each provider, do you have a certificate of CLIA waiver? Because those are instant tests that don't get sent to a laboratory to be processed. They are CLIA waived, but you have to go through the process to have those. I think probably some of you, many of you do. I guess that would be the question, and what we're trying to establish to make sure that you have the training and the ability to administer those tests in your setting.
So I can tell you, Caitlin, that we kind of just learned of the CLIA waiver and I guess the need for that to be able to do these tests. So I'm in the process of, I will be here shortly after the meeting to get this information out to everybody so that they can begin this. So to answer your question, I think a couple of us do. Livescape, I think, indicated that they have a CLIA waiver, and one of our providers in Huron is in the process of getting that. So not very many of us do, but we will do that if that is something that is a absolute need so that we can maintain this priority for rapid testing.
And our Office of Licensure and Certification is who processes those and has committed to doing so quickly in order to make it possible.
Okay.
So
So can we get information on how to apply for it?
That's what I was just gonna ask.
Yes, yep. And so, I guess, gosh, and I've even gotten one for like 10 years in a row, but I couldn't even tell you. It's just making sure you meet certain standards. So it gives you a certificate that you can provide, or you can complete laboratory testing in a non-medical setting, essentially what it is. So the nursing homes all have them. Anything like a blood glucose or a glucometer requires a CLIA waiver. So the process would be just, we have a contact that works on those. There's a paper form to fill out. There is a fee associated. It is like $187 per year. And then that gets submitted, and then you get your certificate. There are some training requirements, I believe. I can't quote them to you, but I could certainly get. So when we talked about this group and other groups that we serve in special populations like mental health treatment facilities, things like that, and we talked about first investigating this CLIA issue, who has them or doesn't, and then knowing what the requirements to get a certificate of CLIA waiver are. Are you interested in pursuing it, or would you prefer to not pursue this type of testing, the Binax now?
I think we want the, oh, go ahead.
I can tell you that we have them, and we're interested in getting them deployed out as soon as possible. This group has definitely been identified. We just got to kind of get our T's crossed and I's dotted, so to speak.
We want them.
Yes, I think that we definitely want them. And if that means that we have to go through the CLIA waiver and get that and expedite that, we'll do that as quickly as we can. Maybe it would be best for, I don't know if Julie, if you could forward that information on the CLIA, or Caitlin, if you, I guess you could send that information to me and I could push it out to everybody. But I'm assuming that everyone's going to have to jump on that very quickly, because we don't want to lose any capacity with those rapid tests.
I would be willing to send that out to everyone.
Okay, that would be perfect.
Is there any way that we get our place in line without having, the waiver in, so they're not distributed to other places that maybe have them? I'm just saying, most of us don't have the waiver. So if we have to, I'm not trying to be greedy. I want to share, but I don't want them all to be distributed, and because we're waiting for the waiver. Sorry, that sounded really greedy. I'm going to just be quiet.
Nope, it didn't. And I understand your question, but I don't know the answer to it. So I will endeavor to find out. I know that because we just kind of got access to these that the Department of Health has, that didn't come straight from manufacturer or from CMS. So we've been hammering out how to distribute them. I'm sure you guys know, and I completely agree with the vulnerability of your population, but you're certainly not the only group that's advocating for getting them. And so just trying to make sure we have a consistent plan for how they're requested, how we fill the request, what our priority groups and orders are. So some of that detail we're just kind of finalizing. I'll find out if we're able to, I don't know how to describe it, kind of like put a log together of who requested what or how much we're going to fill even before the CLIA waiver is cleared, if that makes sense.
Yeah, and I don't mean to be a jerk. We've been talking about quick testing for several weeks now, and this is the first time I heard that I had to apply for something to be able to give them. So hopefully that would be taken into consideration.
And Caitlin, you had mentioned that you're trying to expedite those as quickly as you can. I lost you here on my screen. Oh, there you are. So yeah, there's the licensure department is expediting this pretty quickly, you think?
Yes, she said, I'm so sorry, the person who processes those applications in our state said she can have them turned around in 24 hours. The only sticking point is they go through the Centers for Medicare and Medicaid Services. So CMS wants to essentially receive the fee, and they'll issue the certificate.
Okay, well, Julie, if you could send that out as quickly as you possibly can to everybody, I think that would be a huge benefit, because this is really important. And I know that licensure office will be getting our CLIA applications quickly from everybody.
So Caitlin, you'll send that information on to me, and then I'll forward it out to providers. Perfect.
You'll have to give me just a little bit of time to research it so I can put something together for you on the process.
Okay, thanks.
Well, that's very good news, and thank you for that update. That is a really, really important factor going on right now. There's a lot of our providers are seeing explosions going on with positives, and this is a game changer in managing all of the staffing around those issues. So
Yeah, and we're certainly seeing an increase in cases in our state in general, and you know, the different settings where people are being cared for. So we want to get those to you as soon as possible,
Okay.
and we'll try to be as helpful as I can walking through the process.
perfect. Thank you so much. The other question that we did have was regarding the vaccine, and there was a DOH call, I believe, earlier in the week. And one of the things we just needed some clarification on is it sounds like if you go through CVS or Walgreens, they do all the storage for you and those types of things. But we were wondering that if those entities, if CVS or Walgreens, if they will make contact with CSPs on like how many doses they're going to need and that kind of information. So just needed some clarification on that.
Yeah, so I will admit that I am not a member of the vaccination team. And so I don't have probably the most up-to-date information. I do know that the nursing homes, it seems like a lot of the information sometimes comes from either the OLC listserv or people that get on that long-term care call that are CSP type providers. So again, the nursing homes were given the option to elect to enroll to receive the vaccine directly from CVS and Walgreens. It's a federal contract because they have the ability to dispense or vaccinate right at site. And I did try to find out because Jana had raised that question as well. At this time, I'm not aware that community support providers can enroll in that same program. It's something that's being offered to the nursing home facilities, again, directly from the federal program. And I know they're working on the details for how we will get folks in your settings vaccinated, and also other healthcare workers, you know, the hospitals and those types of settings as well.
Okay, so
That probably didn't clear it up much for you, but I'm not aware that the CSPs can enter into this agreement with CVS Walgreens like the nursing homes can. So basically be a point of dispensing at the nursing home themselves. And we don't have the vaccine yet, but it sounds like whatever version does come will require super cold storage, and there are parameters around once it's thawed, essentially how many days it is viable and some of those things. And then it is a 2-dose vaccine, so it'll need to be tracked also, first dose, second dose.
okay, I think that we had kind of similar questions as to whether or not CSPs would actually be a part of this, because I think there was a couple phases, if I remember right. There was a phase 1 that was going for nursing homes, and then there was like a phase 1B or something along those lines, and then that covered congregate settings and CSPs more related. So do you think that this is going to be information that's going to come out later, or?
I do think so, yes. I know there's a team of people working doggedly on defining each of those things. And then we've also received some pretty specific guidelines of how we need to make it work from the federal government on administering and what the definitions are of the people, what definitions of healthcare workers, for example, who officially falls into that category in phase 1A or phase 1B. So just really working on that distribution plan.
Okay, so I guess then maybe the question would be, well, I mean, if it's going to come out in phase 1B or something along those lines, it might just be a matter of having to wait until that process gets to that point, I suppose.
Yeah, I don't know. I don't know who that, even some of the wording, it's like, for example, who's considered a healthcare provider? Is that a physician? Is that a nurse? Is that a nurse practitioner? There's some of those details need to be hammered out.
Okay. Well, I guess going forward, can you at least put that on your radar?
Mhm.
As far as, that
And it
we're,
is. Yep.
we're ready for that, but we need, so if you get at that information, please, get that to us as quickly as you can. And then maybe we could just do a follow-up on a later date. Maybe I could shoot you an email or send Julie or Joey an email as a basic follow-up to find out the progress on that.
Sure.
Is that fair enough?
Yes. Yep.
So those were the two main items that we had. Am I missing anything? Everybody? Did I cover all of that? Did I miss anything? And is there any other information or questions that we would have for the division or DOH? Going once, going twice. All
So
right,
Dan,
looks
are
like,
you will you be putting together just kind of a roster of all of the CSPs and yes, no on whether or not they have a CLIA waiver?
well, I think we could get that to you right now, probably, and that would be there. So Kimberly Marceau was on the line. I know, I'm not sure if she's still on. She might have had to jump off,
Yep.
but I think,
Oh, this is Kimberly. Lifescape's got a CLIA waiver.
Yeah.
and I don't, does anyone else have one that's on the line? We are missing a couple, but I'm assuming that they don't. But if it would be helpful to you, I could probably put together a quick list for you.
Well,
I think the safe assumption would be no. I mean, Lifescape has their specialty services and their ICF, which
Right.
require them. Nobody else does. So
okay. And I was just going from my own personal experience. I also come from the nursing home, so I thought, you guys do more. I thought more would, but it was not a good assumption on my part. So we'll start working on the process for it.
All right, perfect. Thank you. I really appreciate it. That's a really important piece to this puzzle that we have going on. So I
For
really,
sure. And I will say the last call that I was on with the people who are really making the decisions and trying to get testing available, I said, we need to hammer this out right now because I'm going to get on a call with the CSPs and I want to be able to tell them that they're on a priority list and what the process is going to be to get this testing done. So it is working and we have heard you. And again, Jana and Tom always advocate on your behalf as well.
excellent. Well, we really appreciate it. And so we'll wait patiently for Julie's information to get pushed out to all of us. I think that's a great way to do it. She, has regular contact with CSPs and just seems like that would be the fastest way to do it. Otherwise, it sounds like we're all okay. Is there any other comments or questions for anybody? All right. Well, I guess that's what we had for you today. We appreciate it again, and we'll be in touch.
Okay. Thanks for having me.
Thanks,
Thank you very
Caitlin.
much,
You
Caitlin.
bet. Thanks, everybody.
Bye, everyone.
Thanks.
Have a good afternoon.
Yep, you too.